The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we have Dr. Allie Goodwin with us. She is a chiropractor and an acupuncturist, currently practicing in Austin. She's been practicing for 18 years, split between Colorado and Central Texas, and she enjoys taking care of all people in all stages of their lives with preventative approach to healthcare and specializes in pregnancy care and children. Thank you so much for being with us today.
Yes, thank you for having me. This is so much fun.
I love it because when you approached us, we were talking at the Birth Awards here in Austin. And I remember somebody came up to me and was like, Allie wants to talk to you about being on the podcast. And I was like, then she should talk to me about being on the podcast. And she was like, no, she wants me to talk to you. And I was like, get out of here. Yeah. So I remember you said what you wanted to talk about, which was cranial chiropractic care. And I immediately said, oh, how funny. You're the third person to come up to me and ask me about that for the podcast. And you're like, no, this is different. And it was so cool because all three of you approached me about different things to do with cranial something, but my little self, who knows nothing about any of it, was like, that's all the same. So we're really excited to have you come and teach us about something we don't know much about.
Yes, great. We all do, as you mentioned, kind of different things, right? And we work with the same system, but do different things. So I'm actually looking forward to the other two coming on. I think one does cranial sacral therapy and the other one does cranial fascial technique. So yes, it's a learning, even for me, more in depth about what those other two practitioners do as well. It's all synergistic. We just look at different things, right? And deal with different things.
Yeah, we're excited to continue. We've had one person on already and record with someone else soon. And so when these episodes come out, they'll all be kind of back to back. So we're really excited to be able to kind of give like all facets of this whole thing that's just really interesting. And we, like Sarah said, we don't know a lot about it. I know that it helps, which is great, but
right.
So to start off, can you tell us what is cranial chiropractic care?
So cranial chiropractic care is really about, adjusting the spine as well. So I guess chiropractic, I think you've had chiropractors on before, but chiropractic at its most simplest is really more about nervous system function, right? Again, your brain's master control organ. As it exits the skull, it tapers into the brainstem. Brainstem is incredibly important. There are 12 cranial nerves that come off of that, and then it goes into the spinal cord and spinal nerves, right? There's all of those that take signals from the brain to the rest of the body. So cranial adjusting, especially in infants, although you can do versions of this in adults as well, is really more about adjusting the actual cranial bones themselves, right? Through the palate, through the sphenoid bone, which is, again, kind of the basis for all of the other cranial bones. It's the only cranial bone that touches on all other cranial bones. So cranial adjusting is really addressing that piece. All chiropractors who adjust anybody, pediatric through, I guess, adults, are adjusting the spine itself, but those of us that do cranial adjusting are actually adjusting that piece, which is pretty important. It houses about a third of your nervous system just in that one, in your skull. And again, as you know, babies, there's a lot of pressure on their skulls as they come down and out. There's about 80 pounds of pressure put on a baby's head and neck as it comes out vaginally, right? Sometimes that can be more in a section birth, right, where the doctors are kind of pulling on them to get them out if they're head down. And so all of that kind of misaligns those bones, or there can be a lot of torque. And then you talk about, breech babies, or babies who are asynclitic, right? Head to shoulder, or just kind of in their weird kind of coming down and out. There's even more pressure put on those. But as a baby tucks into the pelvis, those skull bones actually cross over each other, right? Which is why babies are born with a soft spot. So vaginally, that's what that ring of fire is, right? The vaginal tissues are actually pulling those skull bones back into place, but there can be a lot of torque and there can be a lot of misalignment actually in the cranium as well. So cranial adjusting is about addressing that piece of the nervous system, what houses your brain, and again, is very, very, very close to the brainstem.
Wow, that is like so much information. And I feel like on the episode that we already did that will come out before yours on craniosacral therapy, my mind was being blown left and right when she was talking about all of these different things. So, some of it is kind of similar, and it's,
Yes.
still very new to me. And so you're talking about what's happening during the birth process and like how that's causing stress on the baby's head and neck. So what is most important when you're adjusting? Like, what are the things that you're adjusting most?
So for me, I am always looking at kind of, I am adjusting the cranial bones. That is very, very, very important. What I really address the first, which is kind of occiput, which is this backbone, right, of the skull. So it's called CO, right? And then C1 is the atlas, which is the very first bone of the body. And then the juncture between the atlas and the axis, which is the second bone. So that is really the assessment, because the brainstem in a baby actually runs through the first upper three neck vertebrae. And again, when there is distortion here or even here, so many of those cranial nerves then don't function the way that they should be, right? And those cranial nerves go to sucking, swallowing, the tongue, the cheeks, jaw motion, kind of all of those things. So, that really has become my focus. I still adjust kind of the whole spine with a baby, sacrum, definitely check in between the shoulder blades, lower neck, kind of all of those areas. But for me, especially now doing this work, that upper neck junction and then actually what the skull bones are doing is probably it has become my primary focus, when before I wasn't really doing much of that. So it's been an interesting transition to me. The cranial adjusting piece has really been kind of the missing link in my pediatric kind of care. Again, I've been doing this a really, really, really long time. And so it was like I was doing some of this intuitively too, but it really wasn't until I took that course that then it was like, oh, this makes so much more sense. And I see so many more gains in the children that I adjust by adding this piece in.
Gosh, that's so neat. Like it almost seems like, well, why aren't we all doing that then? Like
Yes,
if it
right.
helps that much, why isn't everyone doing that? So you're talking about those things that you're adjusting, dealing with the cranium, but can you talk a little bit about like fascia and cerebrospinal fluid and all of those cool things that you mentioned to us that you are looking for?
Yes. So fascia is actually it's actually really important. It's actually, people think that the skin is the largest organ, and science now is kind of catching up with that and kind of changing it, that fascia is actually the largest organ. And fascia is just connective tissue that is made from collagen and structured water, and it covers everything in our body, right? It covers our skull, covers our sinuses, every nerve, every muscle fiber in the muscle bundle, and then fascia kind of covers that as well. And so when there is injury there, even from birth, I would consider birth, even, non-medicated natural vaginal birth, right? That again, because we already talked about how much pressure is there. That is kind of a fascial, it can torque the fascia, kind of misalign the fascia. So fascia, again, is kind of the largest organ in the body. And what I always tell my patients is if you've ever cut a steak open, right, and kind of pulled apart the piece you're going to eat, and there's that white kind of dense fibrous tissue, that is fascia. So all mammals have that. So the fascial piece becomes important in cranial adjusting because there are 4 major fascial planes in the body. There is one that runs from the tops of the toes actually to the base of the tongue, kind of internally. There is one that runs from the top of the lip actually behind the skull and goes all the way down to the base of the feet. And then there's one on each side. So when we're looking, fascia actually is one of the first movement patterns, are the first, I guess, organ that will take up kind of muscle memory patterns, right? So again, I just mentioned breech babies or babies who are kind of in there wonky, or again, just even in birth, their bodies remember that in the fascial system. So it's almost like a felt sense in the body, not necessarily like an actual physical thing, although there can be physical patterns with that as well too. So when babies come out and they're like, their parents are like, oh, they held their head up immediately after birth, or oh my gosh, we set them down and they rolled over. Those are huge red flags for me because it shows even arching back, right? A lot of people mistake that for colic, right? When babies constantly arch or constantly want to go into that guppy stretch, right? Which is where you're holding them and their head is back. Those are all fascial patterns, right, that we look for. It shows that the fascia has been torqued in a certain way, or there's that sort of muscle memory to that. So with fascia, right, again, we were talking about it covers everything. So then you kind of get into the cerebral spinal fluid. That is actually what temperature regulates and immune system function kind of for the brain. It's also just what we call brake fluid for the nervous system. And again, the importance of cerebral spinal fluid is that it does go in and kind of cushion the brain, but it goes through that sort of upper neck area. And again, if there is dural or fascial torquing along with the bones, then that can narrow that down. And then the brain it's kind of getting stuck there. It's like when you put your foot on a hose, right? That cerebral spinal fluid is not actually flowing the way that it should be all the way from your brain down to your sacrum and back. It's not doing its job correctly. So I think that the sphenoid bone, right? I think we were kind of getting all of these things right are connected. And again, with fascia, because fascia runs all over the body, everything is connected to everything, right? Your right foot is actually connected to the left arm. And then in the skull, there are 12 cranial bones, and again, we talked about the sphenoid, which is just that little X-shaped bone. It sits actually at the back of the heart and the soft palate, right kind of where babies, if molars would come in, kind of right at the back of the jaw. And again, if that gets torqued, kind of misaligned this way, or again, kind of out either side, it can actually put a lot of tension on the fascia itself. So it's a very it's super, super interesting about how many attachments are there, right? Fascial attachments, fascia attaches things to things, right? Fascia attaches the spinal cord inside the vertebra, inside, fascia attaches the brain inside the skull. So we have to kind of address all of those things and we do address all of those things in cranial adjusting.
It's so interesting. I think any of our clients who are listening know how we talk about spinning babies and different things like that. And we talk about fascia release that we do with spinning babies with the balances. And it's hard to explain it to parents, especially when they have never, most people don't really know a whole lot about the fascia or anything like that. Like, oh, fascia. Yeah, for sure. So we do like a 3-minute crash course on why about this when it comes to birth. And we talk about fascia releases in regards to the pelvis and how we do this, like it's called the jiggle, to help release the fascia, and why you could potentially do a fascia release on somebody's thigh, and if you do it for long enough, that fascia can start loosening up because it's all connected. So it totally makes sense when you're talking about the fascia, up here, and how it can just move all over. And I see it. That connection's there for sure.
Yeah. Yes. And one of the questions.
Go ahead.
No, you go ahead.
I was just going to say, I obviously do a very, like you said, kind of like a 3-minute crash course for my patients too, because it can be so much. And again, trying, it's not that I dumb it down. It's really just more about like not word vomiting, trying not to word vomit on people when they come in about like, oh, this is so cool. Because I forget not everybody knows anatomy. Not everybody's a nerd like I am.
Yeah, you're geeking out about it, and they're like, what is she talking about? But
Right.
even you saying this as a full grown adult, you're talking all about like, which I want to talk to you more another time about some of this stuff because I'm like, oh, my connective tissue, I have like an issue with my could I have connective tissue issues? I have suspected Ehlers-Danlos, and I have my like I just don't have it. Like it goes away, and I don't have it anymore. And so that's so interesting to me, all of these things. And you're talking about if you were to adjust these things after a baby is born and all of this, that it can make such a big impact in helping loosen their fascia. They may be having tension because of that. How, this is kind of a question that we didn't really tell you we were going to ask because I didn't think of it, but how long does it take for you? I'm sure there's a range, but like how few or how many may someone have to have before they're seeing results from that to get rid of some of these issues?
So babies are really, really, really easy because they don't actually have movement patterns that are set up, right? We were talking about more of that muscle memory. So again, it really just ranges. The general rule in my office is that if I can see baby and mom as well, but baby before that kind of 2 week mark, right? It really does not allow a lot of these kind of patterns to then take over. What happens is that if there's a muscle or a fascial memory issue there, it will skip the nervous system part of that, and then that becomes the primary pattern really for life. So again, my goal is to really see as many babies as I can, right? We see moms, during their pregnancy, and we talk so much about how that's so important, right? It helps with birth, but really setting these babies up and kind of helping their bodies realign, I guess, from birth and the way that the body is meant to be really does set them up for just better nervous system regulation kind of throughout their life, right? Also, too, it doesn't allow the fascial memory to skip the nervous system regulation piece of that, which is so important. So yes, it is interesting. I know we're going to talk about tongue and lip tie in a little bit, but it's fascinating for me to go kind of through these classes and go, oh my gosh, I wish I had this 44 years ago, right? I have a double
I'm feeling
tongue
like
tie.
I'm screwed. I'm feeling like I got screwed because I didn't get this when I was a baby. You just said that it sets your stuff,
right.
And I feel like at 39, I really probably could have used this a long time ago.
Yes, I mean, we all can. And the great thing is that there's still changes that can take place, right? I mean, even at 39, even in your mid 40s, like I am, right? Adjusting really does change the nervous system every single time you adjust the spine. But then you add in something like cranial adjusting or even checking the sphenoid on adults. So many things can shift even still. I mean, my son's 13 and really, I mean, again, we adjusted him 15 minutes after he was born, but I didn't know any of the cranial adjusting piece. And so actually after I learned this, I went back to him and was like, let me see what your cranium is doing. And he was actually kind of stuck in this coronal suture, the suture right there, which actually makes sense. We think he had a posterior tongue tie that was never diagnosed. He now has an expander in, which again, these things happened before I knew better, kind of. But it was a really interesting thing. He did bust his lip tie by himself. But what I see in my practice is actually with the lip tie, the coronal suture can get really, really, really jammed. And sometimes it's really ridged in babies, and again was able to fix that when he was like 13, 12, he was 13 whenever I took this class, was to go back and be like, oh wait, there are some inherent things there that I need to fix now so that it doesn't bug you for the rest of your life. But yes, you can still have change. It's just much, much easier in babies and children. And I think the original question was, well, how many sessions? It really depends on how old the child is, how their birth went, how much fascial torsion we're seeing. So there's all these things. So what I always tell people is I'm really conservative with my care. I don't really typically do kind of crazy care plans with babies. It really is assessing them every time they come in my office and going, oh yeah, I saw these changes. Now I'm seeing this. Let me see you in, next week, or I really need to see baby again this week. That sort of stuff. So it's really hard for me to give parents any sort of an answer around that because it really is, the body will only adjust to however much it wants to adjust, if that makes sense,
Yeah,
right? Like
no, for
I
sure.
could force change, but I don't want to force change. I want to very easily and gently do this and then allow the body to unwind and then reassess when baby comes back in again.
It's really interesting you saying all of that too about how like it, I love that you said that a C-section actually may end up putting more pressure. Isn't that what you said? And I think
Yeah.
that a lot of people think, well, a C-section is harder on the mom's body, but easier on the baby's body. And that's another
Mm,
example of how it's not, right?
yeah.
Like people do think that. They're like, this is the safest, easiest thing for baby, but it is harder on mom. But there are things, which I won't go into all of them with birth, but that in and of itself is like, oh, well, there's more pounds of pressure actually put on the baby with the
Yeah.
C-section. So that's really eye-opening.
Well, and I think that they're doing so. There's a couple of things about section babies as well. And again, this is just, again, the way the baby sometimes chooses to be born. But yeah, it's not just about the provider kind of, tugging them out. Right now, I think that they're trying to do really, really small incisions and kind of forcing baby. So I don't know if they're trying to like mimic that. I don't know if that's an aesthetic thing or if that is more like they're really trying to get that sort of ring of fire to try to pull the cranial bones back where they need to be. I don't really understand that. If you have somebody you can ask, great.
I think
The
it's the
other thing that
squeeze.
happens in a
They're
vaginal
trying
birth that's, oh, go
they're
ahead.
trying to make a squeeze, like the
Yeah.
squeeze of the lungs that it does to
Yes.
help get some of that amniotic fluid out.
Yes.
That's part of
Okay.
it too. So that's just
Yes.
one of the
So
angles of
maybe,
that.
yeah, maybe kind of all of those, a smaller incision is, and again, that's a really interesting thing. If you can do that with the lungs, can do that with the cranial bones, that's great. The other thing kind of about being born and through a section birth is that, in a vaginal birth, this baby is coming down and has crowned and then turns right before they slip out. Their sacrum actually kind of bumps mom's sacrum as they come down and out. And that is actually what sets up that cranial sacral fluid pulse, right? The cerebral spinal fluid pulse. And so section babies don't get that, right? They don't bump anything to actually set that up. So a lot of times what I see with section babies is that I can't actually even touch their cranium. It's almost too sensitive. But I usually have to go and kind of do some sacral rocking or pumping first to kind of get that bone to set that right pulse up right before I can even go and adjust the cranium. And sometimes that doesn't even happen for a couple of visits. So it just knowing kind of body physiology, anatomy and physiology, and what actually happens to the birth process actually makes this even, I feel like, even more important for those babies who are born via section. Because again, it might be easier for mom, but there are some intrinsic things that they don't get that they would have in vaginal birth.
This is like, if you're watching the feed right now, you're seeing Sierra and I just make faces this entire time because you're blowing our minds. I think what I love about all of these things, about doing this podcast really at all, is that we can have these conversations and we learn so much by doing this. And I hope everyone who's listening is learning through all of this too. But I just always think, and this is something I think I've learned a lot through this podcast, my one of my closest friends had a baby who was breech. They had an ECV that failed and had to rush back for a C-section. And it was a very traumatic birth for both mom and baby.
Yeah.
And this sweet little girl was so colicky. She did all of that like back arching things. She did all of these things. She had all sorts of like food allergies, they thought, to like dairy and different things like that. She had tongue ties, all of these different things going on. And as you're talking, I'm like, whoa, like, and I've known this before, but you're talking and I'm like, it was her fascia. It was all of these things that her body just went through so much trauma. And she actually did go and start chiropractic care and start doing some of the like cranial sacral and different things like that. And she had when she started those things at, I think it was like 5 or 6 months, her baby started gaining weight like crazy. She was all of a sudden the happiest little girl. And she's 5 now, and she and my daughter are best friends. And it's so interesting to think of how hard it was right there at first. And so much of that was probably due to the way that her birth went. And it just makes me wonder, like, how much of that could have been addressed quicker if we had known some of these things that we didn't know then. Even 5 years ago, I think a lot of these things weren't super known.
And that's what's kind of making me go, well, wait, you're saying that babies come in after having a C-section and that you sometimes can't even touch their head because they're so sensitive and it takes a couple of times to get what you need. What about kids who aren't getting this? Because we have lots of babies born by C-section. Like, are they just having long-term effects, or eventually maybe that pulse is made that you're talking about? Like, that's a deficit if we're not doing this. I'm like, how do we not know about this before now? Like, all these people on YouTube, really, if you're watching, you are seeing our eyes like are going wide a million times.
It is incredibly sad for me to think that there are children who don't receive this sort of care, or whose parents just don't know about it, right? And the kind of the benefits of it. And I get a lot of people who I don't see their children until 2 years old or 5 years old or 6 years old. And my always thing is that my favorite quote by Maya Angelou is, you do the best you can until you know better, right? And then when you know better, you do better. And that is kind of one of those things. There's still benefit to doing this no matter what your age is, right? No, I mean, I've had people come and see me in their 60s. Interestingly, I have a little girl who I think I started seeing her when she was 6, and she had a movement pattern, a fascial pattern, where her favorite thing to do was like to hang on to her mom and like rock back and forth and almost like want to go into a backflip. And that is a fascial memory. And so we definitely started doing that kind of. She also had an alpha and kind of small palate alphas. It's like a removable retainer, but it basically forces the tongue to the roof of the mouth. There's actually only one practitioner in Austin right now that does that instead of an expander. Anyway, so she had an alpha, and so we were doing kind of all of the cranial adjusting, but we were also addressing the fascial pattern, the fascial memory pattern, by actually sitting her on my table, and I would just kind of rock her to unwind that fascia, and then actually allow her to go back into almost like a back handspring on the table, right? I would help her kind of facilitate that, and that movement pattern has completely gone away. She no longer hangs on her mom to go back and forth. So again, you see even benefit of it with somebody who, she was a twin actually. To see somebody to have an improvement like that at 6 or 7. So it is kind of wild to me. And again, the whole purpose of me even doing, things like your podcast is really just to try to educate as many people as I can about what it truly is, right? We don't crack your babies. We don't do that. It is about nervous system function and about kind of taking care of those fascial adhesions so that they don't become the primary movement pattern, when they're 6 or 7. I do wonder how many, because I have a little boy, and little boys are, so kind of overdiagnosed with ADD, ADHD. And I wonder how much of that is really about their burst, right? And about, is there constant fidgeting? I mean, no child is really meant to sit in a classroom for 8 hours anyway. But how many of those children are really just trying to move their bodies because it is their body's way of trying to unwind that fascia, but nobody recognizes it? I mean, really, truly. And also to the nervous system piece of that, the nervous system regulation piece of that. So it is very sad.
Wild, man. So I know we were just kind of touching on like tongue ties and lip ties and all of these different things. So can you tell us like how does that affect the cranium and the fascia? I think we kind of touched on this a little bit.
So tongue and lip tie and buccal ties are all kind of fascial adhesions, right? Like really, really, really thick fascia. And I truly believe that the body is incredibly smart. So when it's putting down adhesions, right, there's a functional piece of that. Really in utero, when there's a tongue tie, it is actually keeping the fetus from swallowing its tongue kind of as it's doing that, as it's kind of in there sucking down the amniotic fluid, practicing breathing, kind of all of those things. It's interesting because you were talking about your friend whose baby was breech and there was a failed ECV. Actually, buccal ties in the cheek, that is kind of sideways torsion, right? So again, in the womb, right? Or that's actually, I'm sorry, it's sideways torsion of actually the uterus. The uterus itself can be torqued. And then that actually sets up those fascial ties in the infant because the infant is constantly there. So again, the body is really, really, really smart. There is a gene mutation, the MTHFR gene mutation, which is methylene tetrahydrofolate reductase gene mutation, that does have a role in this. Kind of, we talk about those as kind of midline defects. Does not mean that your baby is not perfect or beautiful. It's just a very, very, very common gene mutation that can set that up as well. So again, those things, when baby comes out with those things, we have to figure out kind of what was going on in the womb. And we do that by looking at what is there, right? Some babies have a tongue tie that needs to be clipped, or some babies have a lip tie, but not necessarily a tongue tie, or no buccal ties, right? That gives me clues as to how they were in the womb and how, and kind of what that fascia is doing and what the cranial bones kind of then are doing as well. And I don't know if I answered the original question to that.
Tell us as much as you want to tell us. Just keep going. We're so interested. Yeah. So how does adjusting help that? And why you said a little bit about why are they having it, right? The position of the uterus, all these things. And even more, my brain is going, spinning babies, spinning babies, spinning babies. Yes. Because so many parents are like, but I feel fine. I don't think I need to do that. They already say that my baby's in a good position. We have a mom right now. She's having her third baby with us, and second with us, third total. And she's like, no, I feel okay. And we're like, do sitting babies anyway, because even though she's in a good position now, but it's hard for us because we don't have your knowledge to tell them the why. And here you go. The uterus can be torqued a little bit, and then your baby might just be so. So if you're on YouTube, you can look, but like baby is head down, but they might be head down with their head cocked just a little bit. And you can't really see that on an ultrasound. And then if you do these spinning babies moves, get your baby out of your pelvis, get the baby put back into your pelvis, now they can readjust in a better way because you also loosened your body up right before that. And it's wild that these things can contribute to these adhesions and then these potential tongue and lip ties. And why would you not just do, 2 to 3 times a week, these 3 balances or whatever within your body and get chiropractic care to try to make it so that there's less of that force on the baby through after they're born that doesn't have that reaction. So what else do you want to tell us about tongue and lip ties and all the things?
So I was about to say, where do I start? So really, if there are tongue and lip tie and buccal ties, and again, a lot of people don't really know what that is, right? So when a mom is going in, or again, is about to have her baby, then we kind of touch on what kind of would mean that baby needs that looked at really, really quickly. A lot of times the nurses in the hospital or the pediatricians aren't very kind of up on kind of continuing education to actually tell parents, oh yeah, there is one, or they have been told in the hospital or by their pediatrician that there's not a tongue or a lip tie, and then they get to me and I'm like, oh, well, do you see this? Or here's this. A lot of times, doing cranial adjusting, because we are adjusting not only where the fascia attaches, right? Those bones, we're actually moving those, which means that we're making change in that fascial system. Sometimes there are babies with tongue and lip tie that actually don't have to have them, clipped or lasered. We can facilitate enough of a change in kind of head shape, in loosening those fascial attachments, where baby doesn't necessarily have to get the surgery, which is fabulous, right? And again, with the plagiocephaly, which we didn't really talk about, the plagiocephaly is just the flattening of the head, right? Usually it's in the backbone. It's usually in the occiput. Usually there's one side that is. That is also fascia. That is also kind of neck misalignment as well. And again, doing this sort of work, because we're actually loosening those fascial attachments and we're actually allowing the cranium to expand the way that it should, means that for a lot of my babies, we don't have to get into a helmet, or if we end up having to go into that route, then they're not actually in a helmet for a very long time, which is actually even better. So again, all of this, the tongue, the lip, the buccal ties, the cheek ties are just fascial attachments that have been put there by the body for a reason. And we need to be doing some work, or the work that I do will actually kind of change and loosen those in order to allow then the cranial bones to expand the way that they should. Interestingly, actually, when you breathe in, the front part of your face and the back, the occiput and the other bones actually kind of go like this. They go like this together. And then the outside, when you exhale, these bones actually move like this. So there is a lot of movement, even in adults, right, with that as well, that can kind of take place. So we typically see a lot of dentists, pediatric dentists will encourage parents to come get cranial or adjusting chiropractic care kind of pre and post. And what I am hoping for is between like a 70, hopefully 80% change in that before they even have to go in for that surgery. And sometimes that's not possible, right? I see a lot of babies post lip tie, but or post frenectomy. That does not mean that we can't still get some really good change in the way all of those bones are moving and the fascial attachments as well.
I'm like taking deep breaths right now, trying to see if I can feel my cranium.
Oh.
I'm just thinking about being a C-section baby who also has an MTHFR or whatever mutation and going, I'm just screwed from all the ends, myself. I'm going to be running over to Allie's office. I'm just going to be running to Allie, just like, when can you get me in? Because I bet I could have a lot fixed. I'm like, you're like a psychic. I'm like, I want you to touch my cranium and tell me what you feel,
I used to do.
Yes, I was about to say, that back in the day, there were people who would touch the bumps on your head and be able to tell your fortune, right? I don't get into that,
you could tell me what might be wrong, and you could tell me you could fix it. Man, I want that.
Yeah, it is, and probably because I've been doing this so long now, there are sometimes, again, I treat very kind of intuitively as well too. And so, yeah, sometimes if somebody's sitting there talking to me, I'm like, were you a section baby, or did you have a really rough or were you ever breech? And they're like, oh my gosh, how did you know that? Yeah, it's kind of but I think that just comes from years and years and years of being in practice, and then also to taking kind of continuing education just to further my skills. But yeah, it would be very interesting. I'd be happy to talk to you kind of about what is going on. There's actually an additional piece for Ehlers-Danlos that might not have been brought up for you at all or as well. So happy to chat outside
Let's
of the
just
podcast.
add another thing, Allie. Just another thing on my list.
I'm so sorry.
Wrong with me.
And no, it's not wrong. It is the way that your body was kind of knit together in the womb, right? The body doesn't usually make mistakes. It just means that you haven't received the right kind of care to help your body better adapt to those things, right?
That's awesome. So how common is like cranial chiropractic care? Can people find this no matter where they are, or is this harder to find a practitioner who specializes in this or has the training in this?
So currently, as far as I know, I think I'm the only chiropractor in Austin as of last year that was actually doing the cranial adjusting. I do know that there is now a guy in New Braunfels, our practice down in New Braunfels, that does it. It is getting, I think, more attention. The cranial adjusting is actually kind of the brainchild of two doctors, Dr. Whitley Caruso and Dr. Morgan Harris, who both have their cranial sacral certifications. And then they also have a certification in a technique called sacral occipital technique, which is by a guy named Dr. Martin Rosen, which places a lot of emphasis on what the sphenoid is doing and what the sacrum is doing. They're also huge family practices. And again, we're kind of being like, there has to be a missing piece in what we're adjusting to facilitate these changes. And so I think that as people are starting to kind of recognize that this may be the missing piece for a lot of us, I think more and more practitioners are kind of signing up to do it, or to kind of take that class and to take the advanced course. So I don't actually really know. I should have asked those doctors that before, like, do y'all have a database of who does this? There are many, many people in Houston who are doing it because both of those chiropractors are based out of Houston. They just put on a really big training up in Dallas, and I know that there were quite a few people there. But as for the Austin chiropractors, I don't really know. But yes, I can find out and we can drop it into the show notes later.
Yeah, that would be amazing if you could send us that information. If you do find it, a lot of listeners who are not just in Texas, so it'd be cool for them to be able to see who else might have that training if they think this is something that would benefit them. So as far as you go, where can our listeners find you? And we'll make sure we link all of this in the show notes as well.
So my practice name is Lotus Chiropractic and Acupuncture. My website is www.lotusatx.com. On that webpage, there's a drop-down contact us form. It'll email us. My office number is 512-270-9580. If you call and you don't get an answer, we do say this on our message too. You can always just text the office and, say whatever it is you need. Sometimes that's easier for us to get back to in between patients. Sometimes it's easier if there's a mom at 2 a.m, right, listening to this podcast, nursing her baby going, hey. Sometimes it's easier for moms to just shoot off a text than having to remember to call during business hours. So anyway, Instagram is also Lotus_ATX. So yeah, not on Facebook, but definitely different ways to kind of get a hold of us. We'd be happy to help you.
This is so awesome and was like insanely eye-opening. And I think it's really just so helpful that you explained the why behind so many of the things that we recommend to our clients. But I do feel like a lot of times people feel like we're just trying to sell them on different things. So like, oh my God, Sierra, like how many things do we have to do? Like babies were born millions of years. What are you talking about? We have to get all of these things. But it's just so different. Where our bodies are different now than they were back then. We're much more sedentary. We're sitting at desks. Like we're not doing the things that we did before. And so you coming on and explaining the why and having this as a resource to our clients and then anyone else listening is invaluable. So thank you so much for coming and sharing your brain. We would love to have you back to talk about a million other topics. I was trying to rein myself in and not talk about all of them in this one podcast episode. But thank you so much for being here. And we look forward to talking with you again soon.
Yes, thank you so much for having me.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.